Looming on the horizon, something you're probably thinking about, and employers across the nation are certainly thinking about, is the Affordable Care Act, known popularly as Obamacare. We need to know how this law is going to affect us, and for that reason I have on the line Brooke Groth, healthcare consultant for Virginia Farm Bureau. Brooke, how are you today?
I'm doing good, Joe. Thank you so much for having me.
Oh, we're very glad to have you here. Well, Brooke, let's get right into it. When will this law begin to affect us?
In some ways, to existing policies, it has already started to impact people. Many individuals and families have noticed changes to their policies as far back as April 2010. However, the big change that everyone's talking about is going to start October 1st of this year. Basically, those Obamacare plans we've been hearing so much about will be available for the general population to review, and many will have the opportunity to enroll in them effective January 1st.
Now, we know that the employer mandate has been pushed back.
Yes.
Okay, but so far the individual mandate is still scheduled to go into effect next year.
Yes, that is the case. And when we throw the terms around individual mandate, I get a lot of questions about that. And people are asking me constantly, well, why do I have to have coverage? This is just for people without coverage. And basically, the individual mandate going to effect January 1 essentially means that the government wants health insurance companies to cover everyone. So then in return, health insurance companies said, hey, we're willing to do that, but in return, you need to make sure that everyone is required to carry coverage. That is huge. So the individual mandate essentially means, hey, if everyone can have coverage, everyone needs to carry it, or they'll go uninsured and potentially face a penalty.
Now, one of the terms that has been thrown around is minimum essential coverage. Can you tell us about that?
Yes, the minimum essential coverage, this is the coverage that the government determines to be the bare minimum standard, and it has to have two primary components. First of all, it has to pass an affordability test, meaning that if it's group coverage, it cannot be more than 9.5% of any employee's income. So that would really cause a shift for a lot of people. It may be more affordable, or it could be less. Also, it has to meet what they consider a 60% actuarial value. And the first few times I heard actuarial value, I said, I'm not really sure how this relates to benefits. So in further investigation, when we talk about actuarial value, that essentially means how much a plan will cover on the essential health benefits before you then have to pay something toward the deductible, co-insurance, or co-payments. So we have people now today that are maybe on an 80-20 plan. That 60% actuarial value would also have an impact on their benefits, not just the cost.
Now, you mentioned essential health benefits. Can you tell us about those?
Yes, these are the benefits. The government has dialed down 10 benefit categories, and what they're saying is, hey, health insurance companies, you need to cover benefits in all these categories. So the federal government has defined the 10 categories of the essential health benefits. From there, the state government dials them down further as to what exactly will be covered. And then health insurance companies, in turn around and dial down exactly how each of those will be covered. So you can see everybody's involved in defining those benefits.
Now, we've heard about the Federal Health Exchange.
Yes.
Can you tell us more about this?
Absolutely. You'll actually start hearing the term more commonly, the health insurance marketplace. They found that was a little more friendly and familiar to consumers as, hey, a marketplace is where I shop for things. And one of the things you'll be doing is shopping for insurance. That marketplace is going to allow consumers to go online and compare health insurance plans each to each other, kind of on a level playing field. So you can look and say, hey, this plan with this company covers this, and it's this price. Company B covers these benefits, and this is my deductible at this price. And you can then determine side by side what plan would best fit your family's needs and budget.
Now, one thing that I'm sure everyone is wanting to know, there are penalties for going uninsured. The big question, what is this going to cost me if I go uninsured?
Absolutely, and individuals who choose to go uninsured. Now, this is going to be significant because not only would they be going without coverage and have a penalty, which would be assessed on their taxes every year, but let's say they decide they want insurance mid-year. If they don't meet one of the special enrollment requirements, they would actually not be allowed to go on a plan until the next year in January. But those penalties are going to start January 1, 2014, and they start at $95 or 1% of the annual household income. Now, it's important to note, a lot of people see these numbers and they're like, wow, I'll just pay the $95 for my family and let that be that. Well, you have to factor in that 1% of the household income because that could be significant. And this penalty is not per household. It's actually per adult in the household. Children are charged 50% of this amount, and for the first year, these penalties are expected to cap off anywhere from $2,000 to $3,000, and that's just the first year per family. So you'll note that as the years go by, the actual assessed penalty rate we have as high as 2016, it jumps to 2.5% of that annual household income, or $695, again, per family, and children are charged 50% less. After that, the government is going to impose what they refer to as annual adjustments, so it could go even higher potentially.
Wow. Well, the penalties you said are tax penalties, so would you be charged this as you're paying your taxes?
Yes. So what would happen is come tax time, individuals who typically receive a return, it would be minus this amount. And individuals who pay in, they would actually have to pay in this amount.
Wow.
Yeah. So it could really change the taxes. Every year some people count on that tax return. So it could really have an impact on a household.
Is anyone going to be exempt from this healthcare law?
Yes, I get this question often in seminars, and sometimes I make a little joke. I'll have maybe a handful of people on Medicare in the audience, and I say, is anyone on Medicare? And several raise their hands, and I say, you can give yourself a round of applause. You are exempt from the individual mandate. So that also means they're exempt from penalties. So any individual on Medicare, Medicaid, TRICARE, CHAMPUS, any of the Indian health services, health ministries, I know there's certain religions that actually have their own group, and they are actually exempt. Also individuals who are incarcerated or they live in another country, obviously.
I think you already mentioned what would happen if you try to enroll after or outside the enrollment period. Is that going to be a very strict deadline?
Unfortunately, yes. So what will happen for this initial enrollment period, the first time anyone's allowed to enroll in these plans, you will have from October 1st to March 31st to enroll in a plan. Keep in mind that if you are uninsured as of January 1st, the penalties will begin to accrue. However, you will have until March 31st to make a plan selection or maybe change. Now, anytime outside that time, you have to have a special enrollment period or a qualifying event, meaning you're either losing what the government considers minimum essential coverage through no fault of your own, maybe you gain a dependent or become a dependent yourself, maybe through marriage, divorce. You have to have what the government is going to dial down as a qualifying event. Otherwise, let's say if you were to come to me, Joe, May 5th and you're uninsured, we would actually have to wait to enroll you in the next enrollment period, October 1st, and it would be effective January 1st.
Now, are these plans renewable? When you sign up for one, is it I'm signing up for life, or is it something you can maybe change your coverage or pick another plan later?
Absolutely. So similar to how Medicare works now, during that annual enrollment period that'll start October 1st every year, let's say you come to me and I'm able to help you with a plan. We'll look over your options. We'll find one that works for you. Well, maybe mid-year your needs change. Maybe you have a new baby, maybe something's different, and you need a different type of coverage. What you would do is touch base with us during the annual enrollment period, and you would actually be able to go ahead and sign up the next year with a different plan.
Okay, that's very good news. Well, we've had a lot of information in a very short amount of time. I know some people's heads are spinning right now.
Oh, I know. Mine was as I was learning about it, Joe.
Well, is there any place people can go to maybe talk this through? Is there anything like that?
Absolutely. I would highly encourage everyone to contact their local county farm bureau office. We have one in every county in the state. I believe the closest one to many of your listeners is maybe Campbell County, and basically what they're going to want to do is stop in there, or they can call any local county farm bureau office. They're going to be able to determine if they receive assistance with their premium and also look at plan options and assist them with enrollment. Like you said, this is information that makes people's heads spin. It's a lot of information to take in, and you truly will need somebody to kind of guide you through that process.
Taking a look at our local farm bureaus, I see we do have one in Campbell County. That's office is located at 923 Village Highway in Rustburg. You can give them a call at 332-5411. Again, that is 332-5411. Brooke, I thank you for taking the time out of your very busy schedule to talk with us this morning.
Thank you, Joe. I had a wonderful time.
Well, so did I. Any parting advice you'd like to give to our listeners?
Please get ready now. It's not too soon to start thinking about your coverage. Swing by one of these offices. We've prepared the staff in every county office to answer questions as simple as, hey, what is my deductible? What does that apply to? How does my co-insurance work? Get yourself prepared and informed now. Many individuals are fortunate enough they don't have health concerns to be worried about, but I do have some that, hey, their coverage is going to change. How will it affect how I'm covered today? I don't want to go uninsured. I don't want to have to accrue a penalty, and I'm not sure where to start. Once again, please feel free to stop by any local Farm Bureau office.
Once again, Brooke, thank you so very much for talking with us, and I'm sure that this was a very valuable time for our listeners to get that information that they will need in the very near future. Thank you, Brooke.
Thank you, Joe.
If you would like more information about the Affordable Care Act, aka Obamacare, how it will affect you, and what you need to do to prepare, head to our website, kdcountry.com. We'll have a link to the Virginia Farm Bureau website, which will guide you into what you need to do to get ready. I'm Joseph Allen. Thanks for joining me.